Now, same surgery, same equipment. I'm Jen, guys, and this is Retirement Dream Builders, where we uncover the places and ideas giving retirees, digital nomads, expats, real freedom, not just on paper. So what if you could get, say, professional medical care without draining your savings or waiting months for an appointment? Now, for more and more expats, that's not fantasy. It's their Tuesday normal afternoon. And the numbers behind it will blow your mind. Now, let's start with the real question everyone asks. How can the same procedure cost 100 times less and still be legit? Now, here's the reality check. When people hear under 99 US dollar surgery, they picture some sketchy background. But here's the truth. These are real clinics, real doctors, and that's exactly what I'll show you across 6 countries where retirees are living proof for this works. Each one offers world-class care for less than a dinner out back home. Now, imagine, guys, walking into a clean, modern clinic, chatting with your doctor in English, and walking out with your procedure done, all for 100 or 100 bucks. Now, in cities like Iloilo, Dumaguete, or Cebu in the Philippines, that's the norm. Now, a dental cleaning, around $6. Yes. A tooth extraction, maybe 10. Even private hospitals, guys, charge for 40 to 50 for full consultations. Now, the system is simple. A clear prices, friendly staff, no surprise billing. It's one of the few places where retirees stay or say healthcare actually feels personal again. And the best part, you're not sacrificing safety. Major private hospitals in Manila and Cebu hold international accreditations like GCI or ISO. Still, it's not perfect. For serious surgeries, you're likely to fly bigger cities. But for routine care and expat handle everything locally without stress, yes, without stress, Philippines is for you. But here's another place where hospitals look like luxury hotels. Yes, you heard it right, luxury hotels. And the price tag will still make your jaw drop. Now, India. So guys, India has become a quiet superstar in global healthcare. Yes, you heard it right, India. Now walk into Apollo hospitals in Chennai or Aster Med City in Kochi and it feels like US private hospitals or hospital. Now spotless halls, advanced imaging, and of course, special trained doctors in London or New York. And a full diagnostic workup, basically often under 100 bucks. The specialist consultation, 20 to 40. And the kicker here, guys, many of these hospitals are GCI accredited, meaning they meet the same international standards as top Western facilities. So expats who live in here talk about how simple it feels. One code, one bill, no drama. The only catch? The paperwork is so straightforward, guys, you might not believe it's real. But the real surprise isn't in Asia. It's in a country where dental care has become cheaper than your phone bill. Yes, your phone bill. Okay, Turkey, the $99 smile capital. Now, Turkey has turned dental tourism into an art form. In Istanbul and Antalya, you'll find clinics that look like Apple stores. Bright, modern, spotless. Now, a filling cost is around 60 US dollar, a cleaning around 80 US dollar, even an extraction can land under 99 US dollar. what shocks most retirees isn't just the price, it's the transparency. Prices are listed right on the wall. You pay upfront, get treated, and walk out, no insurance, no billing department. Now, most dentists speak English or have translators, and larger hospitals are GCI accredited. The only warning, there's so much competition here that quality varies, so always double check credentials and reviews before you book. Now, this time, next stop, a place that's been doing this for long before medical tourism became a buzzword. Now, Europe's quiet healthcare haven. Budapest has been Europe's dental capital for decades. Thousands fly in from the UK and Germany every year because of EU quality care cost a fraction of home prices. Now, if you want a dental cleaning, about 60 US dollar. A white filling, around 90 US dollar. And the setting? Polished clinics with English-speaking staff, modern tools, and of course, detailed quotes before you sit down. Now, after a treatment, retirees spend recovery days soaking in thermal baths or strolling riverside cafes, not sitting in waiting rooms. The downside though, winters are cold and gray, but the savings and peace of mind keep people coming back. But guys, if you're looking for something quieter with mountain views or ocean air, two lesser known spots might surprise you. Hidden health gems. Let's start with Georgia. Now in Tbilisi or Batumi, a general consult costs 30 bucks and dental work often sits comfortably under 100. Now, doctors train in Europe, clinics following EU hygiene standards, and visa-free living for a year. It's no wonder, guys, retirees call it the Europe you can afford. The catch in here is quality varies, so it's smart to ask for credentials and referrals from local expat groups. Now, let's go to Ecuador. Now, in Cuenca or Cueto, private healthcare is modern, clean, and shockingly affordable. A doctor visits cost about 30 US dollar. Many expats basically skip insurance altogether, paying out of the pocket because it's that manageable. Most doctors train in the US or Europe, and they'll often spend real time with you instead of rushing through appointments. The rhythm of life here, mild weather, walkable towns, and mountain air, makes health feel like a natural part of daily living. So, guys, how do you know which country is right for you? And how do you make sure it's actually safe? How to choose smart and stay safe? Now, guys, here's what long-term expats do right. So first, they verify credentials. So check for JCI, NABH, or National Board Accreditation. Real hospitals list it openly. Second, they get at least 3 written codes, including the materials, aftercare, and prescriptions. Third, they plan for the what if. Have an emergency contact at a tertiary hospital and store your medical records in the cloud. As for insurance, guys, US Medicare doesn't cover care abroad. Many retirees either buy global expat insurance or rely on local plans that cost a fraction of what they'd pay back home. The key in here, guys, is being proactive, not reactive. Once you plan properly, the rest becomes easier than you'd imagine. So that's when the real change happens, when healthcare stops being something to fear and starts being part of your freedom. So I want you to think about it. What would your life look like if a doctor's visit didn't come with panic? So, if health wasn't a luxury but part of your everyday lifestyle, across these destinations, retirees aren't just saving money, they're living differently. They're walking more, eating better, and sleeping easier, knowing they can afford to stay healthy. That's what the Health and Adventure Quadrant is about in this channel. Not just treatment, but total well-being built into your lifestyle. So because one, you've seen how accessible healthcare can be overseas, it's hard to look at the US system the same way again. So guys, if this opened your eyes to what's really possible abroad, hit that like, subscribe, and of course, share this video with someone who's ready to live better or less. Now, for more real stories, cost breakdowns, and insider tips on affordable healthcare and retirement abroad, check out the other videos here on Retirement Dream Builders. This is where your next chapter begins. One built on freedom, health, and adventure. See you on the next video.